Hi, my name is Dr. Stacey Johnson, and I am a member of Eta Phi Sorority Incorporated, and I'm also the Assistant Regional Director for the Northeast region. We are working together with the American Kidney Fund to provide community services as well as educational opportunities for our communities that are underserved and dealing with healthcare disparities. Today I will be speaking and educating on Diabetes 101. So what is diabetes? Diabetes is a disease where the body does not properly use the energy from the food that we eat. This can happen in many ways. One way is that the pancreas either produces no insulin at all or very little. The other way is that the pancreas continues to produce insulin. However, the insulin is not used properly by the body. The pancreas is an organ that hides behind the stomach. This organ is what produces insulin to break down the simple sugars that we get or we ascertain from the food that we eat. The food that we eat is broken down into sugars that flow through our bloodstream. This is why you hear people say that they have high blood sugars or they have high glucose levels, because the sugar travels throughout the bloodstream. But in order for it to be used as energy, it needs to go into the cells. And this is why without insulin, sugar cannot get into the body cells. And this is why it's so important to have insulin in your body. So there are two types of insulin. There's type 1 and there's type 2. Type 1 is when the pancreas, it produces no insulin or very little. Usually people with type 1 are 30 and younger, but it can occur in any age group. But usually we see type 1 in individuals who are 30 and younger. But this is when the pancreas isn't producing any insulin or very little at all. Type 2 is what we call adult onset. This is usually individuals ages 40 and above, and this is when the pancreas continues to produce insulin. However, it's not utilized properly. The major differences between type 1 and type 2 is that with type 1, because the pancreas is not producing any insulin or very little, most individuals with type 1 will require either insulin injections or have an insulin pump, because they require continuous or very frequent injections of insulin. Whereas someone with type 2, because the pancreas is still producing insulin, they're not necessarily needing an injection. They will need diet modification, physical activity, and sometimes oral medications. Injections are sometimes necessary. However, with type 2, you can modify your blood glucose levels with diet, exercise, and pills. There are also other types of diabetes. There's one called gestational diabetes. This is during pregnancy. So when a woman is pregnant, it is very important to see your OB and keep your scheduled appointments so that you can ensure that you're assessed and that you and baby are safe throughout this process. There are certain tests that are done by the OB doctor to make sure that we can identify if you do have high blood glucose levels during your pregnancy, so that we can put the proper treatment in place to protect you and baby through this beautiful process. Now, what causes diabetes? There isn't a really known cause of diabetes. However, there are established risk factors. There are risk factors that are controllable and uncontrollable. So some of the controlled risk factors are diet, exercise, physical activity, monitoring and maintaining a healthy blood pressure, no smoking, quitting smoking or don't start at all, limiting your alcohol consumption, and again, weight management is very important, and cholesterol maintenance. Now, some of the risk factors that you cannot control are family history. If you have a strong family history of diabetes, this is something that you must discuss with your doctor, your primary care physician, as well as being of an ethnic group, African American, Hispanic, Asian, Native American. These are high risk factors. Autoimmune diseases are risk factors that you can't control, age, as well as injury to the pancreas. Now, what are some of the symptoms of diabetes? Some of the symptoms of diabetes are the following. When you have high blood sugars, you may experience increased thirst, an increase in hunger even after you have eaten, dry mouth, frequent urination, and unexplained weight loss. Other symptoms include being weak, having blurred vision, numbness and tingling in your hands and feet, having cuts or wounds that slowly heal, dry and itchy skin, as well as frequent yeast infections and urinary tract infections. Now, some of the symptoms of low blood sugar, which is very important to know about as well, are the following: feeling weak and dizzy, feeling hungry, sweaty, pounding heartbeat, pale skin, feeling anxious, having a headache, feeling confused, poor coordination, bad dreams, feeling cranky, mood swings, numbness in your mouth and tongue, and passing out. These are signs and symptoms of low blood sugar that are very important to be aware of. Any of these symptoms that you have experienced or may experience need to be communicated with your primary care physician immediately. There is no cure for diabetes, but there are treatments in ways to control your diabetes. In relation to kidney disease, one of the major things that you must do to ensure that you have good health related to your kidneys is control your blood pressure. This is so important. Make sure that your blood pressure is controlled. Check your blood pressure frequently. If you develop headaches or if you have any signs and symptoms or a diagnosis of high blood pressure, please ensure that you maintain a healthy blood pressure. Decrease any other controlled risk factors, meaning if you're a smoker, quit smoking, limit your alcohol consumption or no consumption at all. Physical activity, increase it to the highest ability that you can. Drink plenty of water and make sure that you always assess your feet for any type of swelling, which is a sign that your primary care physician needs to know, because that can be an indicator of some type of kidney failure. Keys to managing your diabetes: planning what you eat, having a balanced meal plan, exercise regularly. If you're on medication, take it as prescribed. Monitor your blood glucose by taking your finger sticks and keeping your appointments with your primary care physician. If you have kidney disease, again, make sure you keep track of any blood pressure readings that you may take at home, all of your finger sticks, and communicate with your nephrologist if you have one, if not, your primary care physician. I hope this information was helpful and useful, and thank you for listening to Diabetes 101.